Actor Shefali Jariwala's sudden death on June 27th is being closely investigated by police. She had taken her regular anti-aging injection, likely glutathione and vitamin C, while fasting for a religious ritual. Now, what we understand is that hours later, she collapsed and was declared dead at the hospital. Police suspect a sharp drop in blood pressure or cardiac arrest, possibly triggered by the medication on an empty stomach. But no foul play has been suspected so far. Shefali Jariwala had received this kind of treatment for over 8 years, is what we understand. Did self-medication lead to her collapse? Well, investigation is going on. Investigators have recorded 14 statements. They've also seized medications and supplements from her home. They've collected 7 CCTV clips. Her post-mortem was conducted by a 5-member team at Cooper Hospital and videos have been recorded. Now, the final cause of death will be confirmed only after forensic reports are completed, more tests are done. Shefali Jariwala's death has also brought to attention to the pressure that many women, especially in the spotlight and beauty industry, feel to look young. This is a world that praises young youth and perfection. Aging often feels like something to fight with rather than embrace. Shefali Jariwala's story is a reminder that beauty is not about staying wrinkle-free. It's about living freely at every stage of life. What we also need to do is to stop treating aging as a problem and normalize it, see it as something that's natural and meaningful. Let's take a look at some reactions to this story.
Patients who have epilepsy may have sudden unexpected death, and this is more common in patients who are not taking their anti-seizure medications properly or those who have uncontrolled seizures despite treatment. So death is not that much of a rare phenomenon. It can actually affect 1 in every 1,000 epilepsy patients per year, and the risk increases by 6 to 9 times in those patients who have uncontrolled epilepsy or those who are not taking proper anti-seizure medications.
A lot of actors, yes, also seek a lot of therapy, and I'm very happy about it. They take a lot of treatment and I'm very happy about it. But the volume of people who are struggling and trying to be the best is huge. And therein comes the role of all the mega stars or the mega companies. They have not yet established a mental health system.
आपके पास बहुत सारे एक्टर्स यहाँ आते हैं, यंगस्टर्स, और उसके अलावा आपने बहुत सारी बड़ी बड़ी जो फिल्में हैं उनके लिए आपने कास्टिंग की है. किस तरह का एक मानसिक चलन या मेंटल जो एक थॉट प्रोसेस है एक्टर्स की, खास तौर से महिलाओं की, वो आपको देखने को मिली है पहले?
आई थिंक सबसे इम्पॉर्टेंट जो उनके दिमाग में प्रेशर रहता है, क्योंकि बहुत लिमिटेड काम है और जो संख्या है लोगों के एक्टर्स की वो बहुत ज़्यादा है, जो बहुत, और ऑल्सो सडनली द यंग गर्ल्स और यंग फीमेल में एक अननेसेसरी स्ट्रेस चल रहा है कि दे गोइंग टू लूज एज. हम लोग हमेशा एक्सप्लेन करने की कोशिश करते हैं कि एक्टर की कोई एज नहीं होती. आई थिंक वो जो यंग दिखना और जो स्ट्रेस है वो उनको बहुत ज़्यादा स्ट्रेस देता है. उनको लगता है कि हमारी एज जा रही है, एक हीरोइन की सर्टन एज होती है, जबकि ऐसा होता नहीं है.
2 चीज़ें और देखने को मिलती हैं, चाहे वो मेल हो या फीमेल. वो ये होता है कि एक होता है ट्रांजिशन पीरियड, कि जब आप फीमेल प्ले कर लेते हैं, हीरो हीरोइन मेन लीड आप प्ले कर लेते हैं, उसके बाद फिर आप कैरेक्टर रोल्स में जब जाना होता है तो वो जो ट्रांजिशन पीरियड होता है, आपने देखा है कि इस तरह के मेंटल स्ट्रेस उन एक्ट्रेसेस के साथ हो जो बहुत फेमस हो चुके हैं या बहुत जिन्होंने सक्सेस देखी है.
आई थिंक मैंने ऐसा बहुत देखा है, लेकिन द बेस्ट पार्ट अबाउट ये है कि जिनको इस समय इस इंडस्ट्री में रहना है, एक्टिंग करना है, क्योंकि मुझे लगता है कि एक्टिंग ना हर एज में लगातार आपको करते रहना चाहिए. आपको हर तरह के रोल के साथ एक्सपेरिमेंट करना चाहिए. आपका करियर लंबा उसी से होता है, क्योंकि अगर आप बोलेंगे कि ऐसा नहीं है कि बहुत सारे एक्टर हैं जो अभी तक इतने लंबा साल का करियर भी है, उसके बाद ये ऑल्सो प्ले का मदर का पार्ट, ऑल्सो प्ले अदर पार्ट है, उनका करियर जो लंबा होता है. पर कुछ लोग इस बात का स्ट्रेस ले लेते हैं कि यार एक ज़माने में मैं लीड एक्ट्रेस थी, अभी मुझे माँ नहीं प्ले करना है, स्ट्रेस होता है. लेकिन जिसको अपना करियर लंबा बनाना है, जिसको अपना करियर लंबा चलाना है, उनको अपने ऑप्शन सारे खुले रखना है, अगर उनको लंबे समय तक इस करियर में रहना है, क्योंकि एक अच्छे एक्टर का करियर कम से कम 40-50 साल तक को तो रहता ही है. ये वक्त पूरा बदल गया है. जिस तरह की OTT और फिल्में बन रही हैं, जो अच्छा एक्टर है वो लीड होता है. अभी ये बात को समझाना थोड़ा मुश्किल हो गया, क्योंकि जो भी एक पुरानी मानसिकता के लोग हैं जो इस तरह की बात को रखते हैं, उनके लिए थोड़ा स्ट्रेस होता है. पर मुझे हमेशा लगता है कि ये जो बात है कि मैं अभी अच्छी नहीं दिखती, इसका इस टैलेंट से कुछ लेना देना होता नहीं है. आई डोंट नो व्हाई पीपल आर मिक्सिंग लुक्स विद द टैलेंट.
Well, can anti-aging pills be harmful for our health? My colleague Maria Shakil has the details.
Multiple sources have confirmed to NDTV that Shefali's blood pressure was critically low on the day she died, raising urgent questions about her overall health in the lead up to that night. In fact, Mumbai police are now probing multiple leads. One, the possibility of self-medication. Shefali was reportedly consuming skin whitening medication, the kind which is not advised, largely without medical supervision. She was also said to be undergoing anti-aging injections. Was this part of an unregulated wellness routine is the question that needs to be answered by the cops. Or is there more beneath the surface? Another disturbing layer now is food poisoning. Investigators are looking at whether Shefali consumed stale food while she was fasting. Did her weakened system, already under strain, fail to cope? From beauty pills to extreme dietary practices, from injections to possibly expired food, the Shefali case is no longer just one night but a pattern of silent pressures, image, influence, and perhaps choices which have been made in isolation. Remember, the investigation into this sudden death is peeling back layers, not just of what happened that night, but of the life that Shefali Jariwala was living. Sources have now confirmed to NDTV that Shefali had been undergoing specialized anti-aging treatment for the past 5 to 6 years. This wasn't a one-time procedure, it was a sustained therapy, part of a lifestyle. Her regimen, in fact, reportedly included high dosage of vitamin C and glutathione. These are substances which are often used in wellness circles for skin lightening, detox, and so-called youth-enhancing effects. These were not casual supplements, but part of a structured treatment program. Doctors, however, have clarified to investigators that these treatments do not have a direct impact on the heart. But in a case like this, where multiple factors could be at play, nothing is being ruled out yet. What was Shefali trying to change or preserve through years of therapy? And more importantly, did this pursuit of perfection come at a price? These are some of the most uncomfortable questions which are emerging as this story shifts from mystery to a mirror on modern pressures.
Well, what are the larger lessons from Shefali Jariwala's death? Where is the conversation heading? NDTV spoke to a host of celebrities, people who work in the film industry, and this is what they had to say.
It's a heartbreaking tragedy, sudden cardiac arrest, lots of questions being raised about medicines, anti-aging products. But as an actor yourself, do you feel the pressure to stay, in that particular age bracket or appear in a particular way, if I may ask you?
Absolutely. I think one of the biggest things that I am relieved about is the fact that today I can be myself. I thank social media for that, and I thank people for that, because I presented myself as is. I have never done any of these things, and I always say that I don't judge anybody who has. But maybe if I was in the thick of acting today, I would have definitely succumbed under pressure and having to have kept up with all the trends, because it's everywhere. It's being, young teenage girls are exposed and said, let's start Botox as early as, your early 20s and late teens. The trends around us are so pressurizing today. I fear for my daughter. My daughter's 6 years old, and I think by the time her time comes, what's going to happen? So definitely a cause of concern, and somewhere the trend, but I cannot comment as to whether these products or these procedures are what cause an issue. For me, what's alarming is there is a need for better research and data to be shown to us, because all of us are just guessing right now, and it's making us extremely nervous. So we need better research and data so that, as a country, as parents, as youngsters, as Gen Zs, as millennials, we know what to do going forward. We
Absolutely.
cannot live in this thing that this causes this or that causes that. We need answers.
Yes, and we have been speaking to dermatologists and nutritionists as well, Samira. In fact, later on the show, I'll be playing that conversation out for our viewers. They all are talking about, pressure aside, the overall wellness industry. It's mushrooming. The fact is that there are quacks pretending to be doctors who have opened these clinics because of how people seem to be obsessed with looking in a particular way. Does it also have to do with the standards of beauty that we associate with, that it has to be a particular skin tone, and that gives a lot of burden on an individual, puts a burden on individuals? Do you think that there is a need for regulation of the overall beauty industry by the government, and also the fact that most of these, injections or even medicines are available on the counter, and there is absence of trained professionals as well who should be perhaps prepared to carry out these procedures in a more trained and professional manner?
So I think that, every body type is different. And I think that right now there is not the right information is not there for people to make very thoughtful decisions. So I think that there has to be a body that creates the standards to say with this comes that.
Yes.
With weight loss pills comes these issues. And I think this, how you have these disclaimers, especially in the States, I've seen with any medicines that you give, there's always a clear cut, this is what could happen to you. Again, that being said, this is not my layer of expertise. I cannot comment on this, but I would definitely say that there has to be a better system. And I always say with AI, we're using it to make reels, we're using ChatGPT to create better content, businesses are using it. Why cannot we have better AI research backed healthcare? Because every body type is different.
That's right.
And again, one can again speculate that since 2020 people are having more heart attacks, or why is it that it's so many youngsters are having issues? When if you look at our last generation, it wasn't, it's very alarming that it's happening to younger kids. So again, coming back to your question of wellness, I don't think it's wellness in particular. We definitely need a body to overall create better standards for everything from weight loss to wellness to even explaining to younger kids how the fact that diabetes and even high blood pressure seems to be prevalent now in the Gen Zs and the younger generations, right? So I would really want more answers. I think as a parent of like a 5-year-old and a 10-year-old, I want to know that I am better prepared as a mom, because if this is what's happening now, what is going to happen 10 years later? So I think you're right. You definitely need data-backed research to give people answers and give them a way forward, not create panic.
I wanted to first get your opening thoughts on her death. It's important to note that we still don't know for sure, how she died and what, ended her life. But there are all these circumstantial things that we're looking at that make up the life of a young star, Khushbu.
My deepest condolences to the family members of Shefali. But Shiv, I think, what we look at it today are the pressures of the so-called the industry pressures, what they say as to this is how you have to be, this is how you have to look, this is how you have to present yourself, whether it's your hair, makeup, your clothes, you need to have a designer, you have to have a presentator, you have to have a stylist. I think these pressures are from the within, but more than that, I think the pressures are more from the outside world. In today's times, when you talk about social media, this is where the pressure comes from, because everybody sits down. If you're not properly dressed, if your hair, one hair is out of place, if your mascara is running down, or if you're not wearing your lipstick, then I think the pressure starts up that, you do not know how to handle yourself. You're a star, and how do you present yourself? And these social medias, we read the comments, and that is where the pressure mounts, I think. So more than the pressure from within the industry, I think the pressure from outside the industry, from the so-called social media platforms, I think that is what amounts to the anxiety, panic attacks, depressions, and the new term what they have got, FOMO, fear of missing out. I think that is where the pressure comes from.
Khushbu, you speak from a been there, done that kind of a perspective. You've actually faced these pressures yourself personally, and importantly, like you just mentioned, you have seen what that pressure has been like from an external point of view, both before the age of social media and after the age of social media. I want you to tell us about your experience. The reason why you can empathize with these pressures is because you've seen it yourself.
See, fortunately for me, when I was in the industry doing the lead roles and being right at the top, we didn't have the social media
Yeah.
platform and we didn't have these pressures at all. We were just as we are. If we had to, and those days we didn't have these flights, you don't have that, okay, this is how you have to, it has to be your airport look. We didn't have those pressures. We would just wear a normal salwar or a jeans and a kurta and just walk out. Nobody would even bother. And the real fans would be there accepting us as we are. But I have seen these pressures on social platforms about body shaming, about the way they look with my girls when they were growing up. And before the age of Insta or X, there was only Facebook, and we all, me and my young girls, two young girls, were on Facebook, and I saw the kind of pressures and the comments, and the way people would react. I came out of Facebook and I told my girls, you're never going to go back on Facebook, and they are not on Facebook. Neither am I. But on Insta, and even on other platforms, I saw how my girls were ridiculed when they were growing up. They used to be, they are big girls. They were taller than their age. They were the tallest in their class, and they were big. They were obese. And probably to me, being a mother, it didn't bother. But then I have seen the kind of pressures what my girls went through, and it did used to bring them down, bring down their morality, bring down their, they used to have these panic attacks. They used to have this anxiety that somebody is commenting among them. They would immediately start comparing the kids to me that, oh, your daughter is not like you. You're so beautiful. Your children look like somebody else. So I have seen the pressure with my girls. And it's very difficult to make a child understand in their growing up times. But fortunately for me, I was able to handle that and make my children understand that the people who comment, who have these, ideas of being judgmental about the way they look, they're nobody to you. They're absolute strangers. They don't have a face. They don't have a name. You don't know them from Adam. And you don't have to worry about them.
Yeah.
And I was able to put that in my kids' minds, and they're absolutely fine today. They understand how to take the pressure. They've been through it. So, these external pressures are what? I still walk around the way I want. I still don't have a designer. I still don't have a makeup artist. I still don't have somebody who's going to style me when I'm walking into an event or a wedding. I do it by myself, and I'm very, very comfortable by myself. I think when you start feeling that I'm going to lose out in this so-called societal pressures or the way I have to present myself, when you're not ready to accept the realities of life, I think this is where the problem starts.
अमित राय जो कि ओ माय गॉड 2, रोड टू संगम जैसी फिल्मों के डायरेक्टर हैं। अमित, बहुत बहुत शुक्रिया बात करने के लिए। सबसे पहले तो मैं आपसे यही पूछना चाहूँगा कि बाकी फील्ड्स को, बाकी क्षेत्रों को अगर हम कंपेयर करें, तुलना करें उनकी हिंदी जो फिल्म इंडस्ट्री है या फिल्म इंडस्ट्री के साथ, तो आपको लगता है कि यहाँ पर मानसिक तनाव ज़्यादा है या हर इंडस्ट्री में होता है?
नहीं, मुझे लगता है तनाव तो हर क्षेत्र में है। मतलब वो तो शुरू घर से ही हो जाता है आपके। अगर एज फार एज फिल्म इंडस्ट्री इज कंसर्न, प्रेशर तो आपका उस दिन शुरू हो जाता है जिन्हें आपने तय किया कि आपको हीरो बनना है, आपको राइटर बनना है, आपको डायरेक्टर बनना है, या आपको कुछ भी करके यहाँ अपने को साबित करना है। तो आपने तनाव पहले खुद ही ले लिया है। लेकिन अब ये आप पे निर्भर करता है कि आप उसे दबाव की तरह ले रहे हैं या आप उसे अपने कर्तव्य इस तरह ले रहे हैं कि आपने खुद तय किया है, तो आपके कनपट्टी भी तो किसी ने बंदूक नहीं लगाई कि आप हीरो बन जाओ। बाकी चीज़ों में क्या है कि आपने तय किया होता है कि आपको आईएएस बनना है, तो उसकी जो उतनी चुनौतियां हैं तो आप सामना करते हो और वो तनाव को आप पार करते हो। लेकिन इस क्षेत्र में ऐसा है कि आपने खुद तय किया है कि आपको सब कुछ छोड़ छाड़ के, जिसका कोई गारंटी नहीं है, जिसकी कोई श्योरिटी नहीं है, वहाँ आपको आके एक्टर बनना है या राइटर डायरेक्टर बनना है या जिस भी क्षेत्र में कॉस्ट्यूम डिजाइनर या आर्ट डायरेक्टर बनना है। फिर सामाजिक प्रेशर भी है कि आप जिस गली से निकल के आते हैं, जहाँ जिन दोस्तों ने आपको चढ़ाया है कि यार तुम्हारी आवाज़ तो मतलब माशाअल्लाह, तुम तो सोनू निगम और अरिजीत को पानी भरवा दोगे, या यार क्या हाइट है तुम्हारी, यार तुम जाओ बच्चन के, यार तुम नेक्स्ट बच्चन हो, या तुम कितनी सुंदर हो यार, तुम भी आराम से कियारा आडवाणी के बाद दूसरी कियारा आडवाणी। तो ये प्रेशर तो आप पर आ ही जाता है। फिर वापस आने के बाद जब इस शहर में आते हैं तो ये शहर क्षेत्रफल में छोटा है, बाहें इसकी बड़ी हैं, तो जब आपको समेटती हैं, तो जब आपको ऐसे समेटती है तो वहाँ भी एक दबाव महसूस करते हैं आप कि आप कैसे सर्वाइव करेंगे, आप किस तरह अपना काम करेंगे और पैसे कैसे अर्जित करेंगे। और फिर दिन ब दिन आप पर एक दबाव बना रहता है कि कब होगा वो दूसरा दिन जिस दिन आप ये साबित करेंगे। फिर सफलता का आप मापदंड बना लेते हैं कि मैं जिस दिन ये फिल्म कर लूँगा उस दिन, फिर वहाँ भी आप फंसते हैं कि आप सफलता का मापदंड आपका है क्या। और चौथा जो सबसे बड़ा प्रेशर है कि समय किसी के पास भगवान ने अलग अलग नहीं दिया है, सबको 24 घंटा ही दिया है। आपका बायोलॉजिकल क्लॉक चालू है, आप अगर उसको नहीं पकड़ रहे हैं सही समय पे तो एक टाइम पे आप हीरो से फिर फादर के रोल में जाएंगे, और वो तभी भी नहीं हुआ तो फिर आप बस्ता उठाकर घर जाते हैं वापस, और वो जो निराशा लेकर जाते हैं अंत समय तक, जब तक आप सांस देंगे आखिरी, तब तक वो आपके साथ चलता है। तो दबाव तो निरंतर है।
ये जो इंडस्ट्री है, हमेशा से माना जाता है कि जो भी लोग इसमें आते हैं, खास तौर से वो जो कैमरा के सामने हैं, वो खूबसूरत दिखने चाहिए, कद काठी, तो उसके लिए जिम होता है, उसके लिए बहुत सारी ऐसी चीज़ें होती हैं अपने आप को खूबसूरत रखने के लिए, मेडिसिन भी होती हैं। तो ये मुझे बताइए कि ये दबाव उस तरह से लेना कि एक कोई भी शख्स है या जो कि खूबसूरत है और लंबा चौड़ा भी है, दिखने में भी अच्छा है, लेकिन उस खूबसूरती को बरकरार रखने के लिए जो बाकी और प्रोसीजर्स होते हैं, उसके आप कितने फेवर में?
नहीं, देखिए मुझे लगता है ये शोषा तो अब शुरू हुआ होगा जब अंतर्राष्ट्रीय, जिसको हम लोग ग्लोबलाइजेशन कहते हैं, और जब सारा प्रोडक्ट यहाँ कूदा होगा। मतलब राइट फ्रॉम व्हेन ऐश्वर्या राय एंड सुष्मिता सेन बिकेम द ब्यूटी पेजेंट एंड दे वन द टाइटल, तो उसके साथ बाज़ार भी तो आया ना, बाज़ार उतरा, बाज़ार ने फिर एक स्त्रियों के लिए एक नया बाज़ार खड़ा किया। जिस दिन से लोगों ने बॉडी बिल्डिंग शुरू की और हमारे एक्टर, शायर, टीचर और सामान्य घर अमोल पालेकर से छोड़कर, अमिताभ बच्चन से छोड़कर, धर्मेंद्र से छोड़कर वो सीधे एकदम जिम वाली बॉडी पे आ गए, तो फिर दूसरा प्रेशर बनना शुरू हुआ कि अब लोग यही पसंद करेंगे। देखिए क्या है, ये आप अपना खुद ही बना रहे हैं, ऐसा कुछ है नहीं। ये बिल्कुल वैसा है कि आप घर के अंदर बहुत चिल्ला रहे हैं कि बाहर बहुत बारिश हो रही है और बाहर झमाझम धूप निकली हुई है। आप जब जाके पता करेंगे तो पता चलेगा बाहर झमाझम धूप निकली हुई है। आपने अपने मन में ये ख्याल बनाया कि बाहर बारिश हो गई और पूरा नदी तैर रही है, तो मैं तैर के कैसे ऑफिस जाऊँगा या ऑफिस जाऊँगी, ऐसा बिल्कुल नहीं है। आपने पहले तो अपने टैलेंट पर भरोसा रखना चाहिए। आप जिस तरह खूबसूरत लगेंगे वो आपकी यूनिक पर्सनैलिटी है। आप चाहते हैं किसी को एक मानबिंद बनाकर, आप सब लोग वैसा बनना चाहते हैं। तो अगर वो दो सुपर या ये बन गए हैं, क्या बोलते हैं, ब्यूटी क्वीन जीत गए टाइटल, तो आप सब एक होड़ लगी है कि सबको वही बनना है। वो कोई तीसरा नहीं बनना चाहता, सबके लिए एक रेफरेंस पॉइंट हो जाता है और वहीं फंसते हैं आप। और जब आप फंसते हैं तो फिर ऐसे आपकी जान जाती है, फिर वो गला आपके यहाँ तक आता है।
Well, my colleague Abira spoke to a 40-year-old woman who went through major side effects after taking glutathione for skin lightening and immunity. In fact, she also filed a police complaint after that, and this was the treatment that cost her over 40,000 rupees. Have a look.
With Maggie. Maggie, welcome to NDTV. I'm really sorry for what happened to you, but you need to tell our viewers what medicines were you taking, how did this happen, and what really happened?
Sure. So, yeah, thank you so much. So, how it started is I was Instagram and I saw a certain advertisement talking about stress release, making your skin lighter, and increasing your immunity. There is a clinic, I would not like to name it now. So I went there, and it is a big setup. It's a big trapping setup, I would say. They call you and there are a couple of doctors who consult, and they make you sure that they make you understand and believe that your skin color is actually very dull. You need a lot of treatment, you need a lot of face PRP. The doctor consultant, like I said, they told me that you have so much of discoloration, your skin has a lot of problem, your skin has a lot of pigmentation, and they offered me a treatment.
Made you feel bad?
Absolutely, they made me feel bad, and I felt like, oh my god, everybody is doing it, why I shouldn't do it. So I just discussed, and they offered me a package of 10 IV drips glutathione treatment that will happen once a week. Along with it, basically they suggested me that I should go for face PRP 3 sessions. And
what
they
is a face PRP?
Okay, so they take out the blood from your vein, they remove the plasma from the that blood, and that plasma it again put in your skin, on your face, wherever you want to do it. It can be your scalp for hair treatment, it can be the face, and they put that plasma through injection. They inject it. Yeah, they inject it on your face wherever they feel like, for the fine lines and stuff like that. So I was against it because the main purpose I went to do all of it, because like I said before, I wanted to increase my immunity reduce my stress level and have a normal life, and it can add to my skin discoloration, skin lightening. Why not?
And also, did they tell you about the side effects?
They never told me the side effect. I am somebody who explained them about my medical history, the kind of reason I have and why am I going ahead for the treatment, and they never explained me any kind of side effect. They inject the glutathione or vitamin C, and that goes in your blood. It was a yellowish substance that was going in. Immediately I started feeling the effect, and I was telling that I'm not comfortable. So she reduced the speed of the IV drip. Once it was done, finished in 10-15 minutes, I had a severe headache, nausea, vomiting. My left side, I felt there's something happening, terrible backache. And I was not able to get up, and I was on the bed lying there for 15 minutes. Then after 10-15 minutes, when the beautician understood that there's something wrong, then she called the doctor. After 3-4 days, I started getting a lot of acid reflux, and I didn't understand. I'm somebody who never had the problem of heartache, heartburns, acidity or acid reflux, and I started getting a lot of cough and cold. My cough and cold aggravated, and I started calling that clinic constantly, the doctor, and messaging them on WhatsApp, and they started ignoring me. Initially, for a couple of 1 to 2 calls, they told me it's a generic process, you already had cough and cold, maybe it's because of that. So after taking this, I started developing rashes on my upper palate.
Well, it's time for a short break. More news on the other side.